Hello. As a doctor, I'm often asked, "Doctor, I think my blood is too thick. Should I be thinning it?" That phrase is quite common. Let's clarify what is really meant by blood thinning and when it's needed. In reality, the term blood thinning shouldn't be taken literally. The blood doesn't turn watery like water. What's meant is reducing the blood's tendency to clot, i.e., decreasing its ability to form clots, thrombi. Blood clotting is a natural and essential process. When you cut your finger, clotting stops the bleeding, the blood forms a clot that seals the wound. Without this mechanism, even a small injury could become dangerous. But sometimes, clotting activates where it's not needed, inside blood vessels, without any wound. Imagine a tiny, invisible plug forming in an artery or vein. This kind of clot can block blood flow. If it happens in a heart vessel, it can cause a heart attack, in the brain, a stroke. A clot in the deep veins of the leg can break off and travel to the lungs, causing a life-threatening pulmonary embolism. So, excessive clotting can lead to serious consequences. Thinning the blood means preventing the formation of unnecessary clots. Doctors call this thrombosis prevention or antithrombotic therapy. In simple terms, it's treatment that helps keep blood from clotting where it shouldn't. Special medications are used, commonly referred to as blood thinners, anticoagulants. These don't dissolve existing clots, other emergency drugs do that, but rather prevent new ones from forming. Who needs blood thinning treatment? Mainly people at increased risk of thrombosis. For example, those with certain heart conditions, serious arrhythmias, which can lead to clot formation inside the heart, people who've had deep vein thrombosis or embolisms, or patients after certain surgeries. A doctor will assess the situation and prescribe these medications to protect against heart attack, stroke, and other complications. It's important to understand that healthy people should not take blood thinners on their own for prevention. There used to be a rule that everyone over a certain age should take low-dose aspirin to prevent clots. But modern research shows that without a specific indication, this can cause more harm than good, especially by increasing the risk of internal bleeding. That's why only a doctor should decide if such therapy is needed. In this series, I'll explain in simple terms the most effective options for reducing blood clotting. We'll talk about prescription medications, over-the-counter options, like aspirin, and natural remedies and supplements that affect blood viscosity. I'll explain how they work, when they're used, and what precautions to consider. Let's begin with the most common prescription blood thinners. Several key medications are prescribed to reduce blood clotting. Let's look at the main ones. Warfarin. This is one of the oldest anticoagulants, drugs that prevent clotting. It reduces the activity of vitamin K in the body, which the liver uses to produce clotting factors. Warfarin is very effective but requires careful use. Regular blood tests, called INR, are needed to ensure the correct dose. It also requires dietary attention, avoid excessive intake of foods high in vitamin K, like leafy greens, and be cautious when combining warfarin with other drugs. Pros: inexpensive, well-studied, has an antidote, vitamin K, if overdosed. Cons: slow onset of action, takes a few days for full effect, constant blood monitoring, dietary restrictions, and many drug and food interactions. Newer oral anticoagulants, apixaban, rivaroxaban, dabigatran. These modern drugs, sold in the U.S. as Eliquis, Xarelto, Pradaxa, have become popular alternatives to warfarin. They directly block key clotting factors. Apixaban and rivaroxaban inhibit factor XA, dabigatran inhibits thrombin. Pros: fast-acting, within a few hours, no need for regular blood tests, not dependent on diet, lower risk of brain bleeds compared to warfarin, easy to take at fixed doses. They're commonly prescribed for atrial fibrillation, to prevent strokes, and to treat/prevent vein thrombosis. Cons: expensive, patented drugs, not suitable for patients with mechanical heart valves or severe kidney disease, and although some now have antidotes, reversing their effects during bleeding is harder than with warfarin. Heparin and its derivatives, injectable forms. Heparin is an anticoagulant administered via injection or for. It's used in hospitals for rapid anticoagulation, such as in acute thrombosis or pre-surgical situations. Low molecular weight heparins, like enoxaparin, are injected under the skin and used short-term after surgery or temporarily in pregnancy, when warfarin is contraindicated. Pros: very fast action, useful in settings where oral drugs aren't appropriate. Cons: injectable form, typically used under medical supervision. Each medication is chosen based on the patient's needs. There's no best drug, only the most suitable for a given situation. The key is to take them exactly as prescribed and have regular medical checkups. Next, we'll talk about over-the-counter options like the widely known aspirin. Among non-prescription drugs, the most famous, blood thinner, is aspirin. There are also a few other over-the-counter substances worth mentioning. Aspirin, acetylsalicylic acid. Originally known for pain relief and fever reduction, aspirin in low doses is also used to prevent clotting. It prevents platelets from sticking together. These are blood cells that trigger clot formation. In simple terms, aspirin makes the blood less sticky. Usually, a low daily dose, 75 to 100 milligrams, known as baby aspirin, is used. Special formulations like aspirin cardio are designed with a coating or combined with stomach-protecting agents, like in Cardio-Magnol, to reduce stomach irritation. Important: aspirin can cause ulcers or internal bleeding with long-term use, so it should be taken after meals and with water. For decades, aspirin was the go-to drug for preventing heart attacks and strokes in people with existing cardiovascular problems. However, newer guidelines advise against routine aspirin use in healthy individuals, due to bleeding risks. As always, a doctor should decide if aspirin is appropriate. If aspirin isn't suitable, due to allergies or ulcers, a doctor might prescribe other antiplatelets, such as clopidogrel, Plavix, but these require a prescription. Other over-the-counter drugs. Some common pain relievers like ibuprofen or naproxen are also NSAIDs, nonsteroidal anti-inflammatory drugs, and can slightly reduce clotting. But they are not used for long-term clot prevention, as they have more side effects, like stomach bleeding, and don't offer the same heart protection as aspirin. In fact, long-term NSAID use may increase cardiovascular risk. So, aspirin remains the main non-prescription option for clot prevention, but only if advised by a doctor. Some vitamins and supplements also affect clotting, like fish oil, omega-3, vitamin E, and ginkgo biloba. We'll cover these natural options in the next episode. Many foods and herbs naturally have blood-thinning properties. Let's look at some of the most popular examples. Garlic contains allicin, which reduces platelet aggregation. Moderate garlic intake, 1 to 2 raw cloves per day in food, can have a mild antithrombotic effect. Note: too much garlic, especially on an empty stomach, may irritate the stomach and enhance the effect of anticoagulants, raising bleeding risk. Ginger. Fresh or dried ginger contains gingerol and shogal, compounds that prevent platelets from clumping. Ginger tea or adding ginger to meals can improve circulation. Note: excessive ginger may cause heartburn or intensify the effects of blood thinners. Turmeric contains curcumin, a natural anti-inflammatory that also likely reduces clotting. Commonly consumed in curries or teas. Note: large doses or concentrated turmeric supplements may thin blood too much, especially when combined with medications. Omega-3 fatty acids, fish oil. Found in fatty fish like salmon, mackerel, and sardines, omega-3s reduce platelet stickiness. Regular fish consumption or moderate dose fish oil capsules is associated with lower clot risk. Note: doses above 3 g per day may cause nosebleeds or other minor bleeds. Stick to recommended amounts. Other natural blood thinners include ginkgo biloba, an herbal extract that reduces platelet aggregation, high doses of vitamin E, some berries and fruits, cranberries, grapes, citrus, and spices, cinnamon, cayenne pepper. Their effects are mild and best used as part of a healthy diet rather than in concentrated form. Even plain water helps. Staying hydrated prevents your blood from becoming overly viscous. Natural remedies can complement prescribed therapy, but do not replace it when clotting risk is high. Always discuss supplements with your doctor, especially if you're already taking blood thinners. Blood thinners are life-saving medications, but they must be used responsibly. Here's what you need to know. Interactions and combinations. Never start extra blood thinners without medical advice. Using multiple agents increases bleeding risk. Some drugs and foods also affect clotting. NSAIDs, ibuprofen, naproxen, increase the risk of ulcers and bleeding when combined with anticoagulants. Acetaminophen is usually safer for pain. Warfarin, avoid abrupt dietary changes, especially green vegetables high in vitamin K, and consult your doctor before adding any new medications. Many affect warfarin's action. Supplements and herbs, garlic, ginkgo, and high-dose omega-3s can enhance blood thinning. Talk to your doctor first. Who needs them and who doesn't? Doctors prescribe antithrombotic therapy to those at high risk for clotting or with a history of clot-related conditions. Main indications include past heart attack or stroke, presence of stents or mechanical valves, atrial fibrillation, episodes of deep vein thrombosis or pulmonary embolism, or inherited thrombophilias. Contraindications include active bleeding, e.g., stomach ulcer, recent brain hemorrhage, serious bleeding disorders, like hemophilia, dangerously high uncontrolled blood pressure, pregnancy, some drugs, or severe liver disease. Every case requires individual evaluation. Everyday precautions. If you're on blood thinners, avoid high-risk activities that could cause injury, contact sports, dangerous hobbies. Use a soft toothbrush and an electric shaver to minimize minor bleeding. Limit alcohol intake. Wear a medical ID bracelet or keep a card in your wallet stating you're on blood thinners, invaluable in emergencies. When to seek immediate medical help. Blood in stool or urine, black tarry stool or red streaks. Vomiting blood or coffee ground-like material. Sudden numbness, weakness, or speech issues, signs of stroke. Sharp chest pain, breathlessness, coughing blood, possible embolism. Head trauma while on anticoagulants. Even less serious symptoms, like frequent nosebleeds or excessive bruising, should be reported to your doctor. Doses may need adjustment. Finally, never stop your blood thinners without consulting your doctor. While fear of bleeding is valid, these medications greatly reduce your risk of heart attacks and strokes. When used correctly, the benefits far outweigh the risks. Stick to your doctor's instructions and check in regularly. Stay safe and take care of your health.